A 27-year-old woman was rushed into the emergency room after a devastating car accident. She had suffered serious internal injuries. Doctors immediately began working to stabilize her, but as test results came back, it became clear that she was losing blood rapidly. Without treatment, she might not survive the night. The trauma team knew exactly what she needed: a blood transfusion. In most cases, the decision would have been simple, but this case was different. While preparing her for surgery, a nurse discovered a signed medical directive among her belongings. The document clearly stated that she refused blood transfusions for religious reasons. The instructions were specific, the paperwork was valid, and the patient had signed it while healthy and fully capable of making her own decisions. Suddenly, the medical emergency became an ethical dilemma. Doctors weren't debating whether blood would help. Everyone agreed it would. The question was whether they had the right to ignore the patient's wishes. As family members arrived at the hospital, emotions quickly escalated. Her husband begged doctors to save her life. If a transfusion could help, he wanted it given. He couldn't imagine losing her. Her parents felt differently. They knew how important her religious beliefs were. To them, ignoring her documented wishes would be a betrayal of everything she believed. The family found itself divided during the worst night of their lives. Meanwhile, the patient's condition continued to worsen. Doctors consulted hospital leadership, ethics specialists, and legal advisors. The answer remained the same. Competent adults have the right to refuse medical treatment, even treatment that could save their lives. The medical team would honor her decision. Surgeons proceeded using every alternative available. They fought for hours to save her. Everyone hoped another solution would work. But despite every effort, her injuries were too severe. Later that night, the patient died. For some family members, there was comfort in knowing her wishes had been respected. For others, it felt impossible to accept that a potentially life-saving treatment had not been used. Years later, healthcare workers involved in the case still remembered it. Many believed they had done the ethically correct thing, but some continue to wrestle with the same question. If saving a life means violating a patient's deepest beliefs, is it still the right thing to do? The case remains controversial because reasonable people can disagree, and that's what makes medical ethics so difficult. Sometimes the hardest decisions aren't about what doctors can do, they're about what they should do.